Experts in our lobby today. I'm glad we're doing this topic because this is kind of close to your heart. I know your mom had colorectal cancer.
She did, yep.
You have a friend that has it now. I've had 2 screenings for colorectal cancer. There's a stigma attached to it, but I'm telling you, 20 minutes, 30 minutes out of your day could save your life. Is that right, doctor?
Absolutely.
When do you get a colorectal screening, and how important is it?
So everyone should get it at the age of 50, but people with special risk factors should start earlier. And most people don't understand that 1 out of 5 people will actually have a polyp when they get their colonoscopy.
Now, the thing with polyps, too, is that the polyps that you see early on a lot of times aren't cancerous, but you leave them in there a long time and they can become cancerous, right?
Absolutely, and that's the advantage of colonoscopy, because not only can we detect cancer, but if we find these polyps before they become cancer, then we'll save your life.
Dr. Kim, Mark talked a little bit about stigma. Do you think that that's lessening as time goes on and more people are talking about this a little more candidly?
Absolutely, and it's just an easy thing to do. The worst part is the bowel prep, but you do that in the privacy of your own home, and the rest of it's under sedation, so you don't even notice. And
we talked about it. You know, if you have a family member who has an incident of colorectal cancer, you get a screening much earlier. I had my first one in my mid-30s. It's really never too early, especially if there is, a family history there.
So the guidelines are someone is less than 60 years old at the age of diagnosis, their first-degree relative should be done at the age of 40.
That's a good point. Also, don't forget, this is something that only takes maybe 2 or 3 hours out of your day, but it can save a life. Don't prolong it. And if you have any questions about the procedure, as Dr. Kim mentioned, you're under sedation for most of it. The worst part of it is just cleaning out the bowel, right?
Absolutely.
So we want you to call these people behind us if you have any questions about the procedure. If you're nervous about it, or you don't know where to get it and you have questions, these people can help you. The number's up on your screen there, 877-908-0680. They can answer your questions here. They're all with Intermountain Healthcare, good folks, and they're willing to take your calls right now. You may have a problem. A lot of times you don't get a lot of symptoms, do you?
No, actually the majority they do not have symptoms.
Okay, Dr. Kim, thank you so much for being with us. Thanks for the information. 2 News at 5 will be right back.